So say part one, and this is part one, and then when you get to part two, say this is part two. And when you get to part three,
do I say that it's part
you'll
three?
say it's part three, yeah.
Wow.
That's exactly.
So is it part four, then I say part four?
We won't have a part four, but if we were to have a part four, yes, that would be.
Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. And today I wanted to go through facelifts. It's a pretty wide-ranging topic, so I wanted to break it into three separate parts. First part, I just wanted to go through facelifts a little bit in general, some kind of myths and some things that are true about it, and go through some good facelifts. The second part, I want to go through some bad facelifts, some facelifts that I think one of the first things is that it's noticeable or detectable, but we'll be going through that as well. And then lastly, I want to talk a little bit about male facelifts, because they're very different than female facelifts. And I think that's important for particularly males to know, but everybody to know maybe what went wrong with some famous celebrity male facelifts and how to avoid getting yourself into that situation. So talking about facelifts in general, a lot of women, men, whoever hear the term facelift, they immediately, the first reaction is, or knee-jerk reaction is, oh my God, am I that old? I need a facelift. In the past, it was a procedure that was done in much older patients. Patients waited until they looked old and skin was hanging, and they lost a lot of volume in their face, and the people are like, you need a facelift. I see that there's a trend nowadays tending towards younger. Patients doing these procedures younger, earlier, more preventative, setting the stage, as I say, or doing these surgeries before it gets too extreme so that they enjoy 30s and 40s and 50s and so on. So I do think that trend is okay in some instances, and we're going to go through a little bit of that. One of the things in general, I think patients will, when they come in, they say, what is a facelift going to look like? And I'll say, well, what's bothering you? And if they're doing this sort of a thing to their face and their necks and the necks coming down, that's usually the indication they may be thinking about a facelift. Now, that's different than if it's just some extra fat or double chin and simple things like liposuction can fix. But when the skin starts to sag and the face starts to deflate, we got to look at different things as far as how do we rejuvenate that? How do we make patients look younger? And so one of the first things we see when we're aging is that the face starts to flip. It's called the inverted triangle. In other words, from becoming heart-shaped or triangle this way, it flips the other way and becomes bottom-heavy. When we start to see the jowls, we start to see things in the neck forming, bands in the neck forming, the frown lines forming, or what we call marionette lines, nasolabial folds forming, the mid part of the face deflating. All of these things start to change as we get a little bit older. In general, what patients need to understand is that everything's changing. It's not just the skin. The bones are going in a little bit. The fat is dissolving in the face a little bit. So as all these other structures are changing, the skin starts to also change and sag and lose elasticity. So when doing a facelift or doing procedures, you want to address all of these things, not just one. When we're coming in and we're looking at your neck, you may say, well, I'm getting these bands in my neck and the skin's falling, and that has to do with the muscles in your neck. And as they fall, you'll get bands from the platysmal muscle or neck muscle, and you want to tighten those up and lift it. That's the first part of a facelift. The second part of a facelift is then, once this is tightened, to pull and tighten the jawline and remove that extra skin. You have to hide it somewhere. Where are you going to hide the incision and remove that skin? And obviously, if you're pushing it up, you're going to hide it by the ear. When you're looking at yourself, you have to be realistic about it, and also what's going on. Is it a skin problem, a fat problem, a muscle problem? And then do the correct surgery to correct all the things that are going on with it. So good facelifts versus bad facelifts. What determines the difference? There's multiple opinions on this. I think personally a balanced facelift is the best. What does that mean? The facelifts have evolved. In the very beginning, they only did skin-only facelifts, where they just pulled skin out. And those were the patients that looked windblown or like the Joker and overdone. What people began to realize is it's not just pulling skin tight, that we need to fill things and replace things that are changing with aging. So then we went into the realm of fillers and plumping and fat grafting. And I think, again, there's some examples of that went extreme. So if we look at patients like Kim Novak or other patients, they started getting overplumped or overfilled. That's also not what you want. Then we look at patients maybe more like a Demi Moore, some other patients where they've overpulled. That's not good. So the real answer is that balance. Not overfilling, not overpulling, doing a little bit of both. And that way the result's very natural, very soft, and very pretty. I think that doesn't give away the secret. It becomes much less detectable when it doesn't go too extreme in either one of those directions. The last thing, or second thing I want to point out, is the vectors of pull. In other words, it's not natural for someone to be pulled straight up or straight back. You have to be, there has to be some judgment on the natural lifting of the skin and what direction we're pulling. If we look at some patients, even our current president, Joe Biden, or other patients where you see odd lines pulling up and strange muscle lines in their faces, that's an indication that things were lifted and pulled in the wrong direction. That's not natural to the anatomy, and you're going to see that. You're going to see when they turn that there's weird creases in their necks or weird expressions, and those are things, again, that are giving away the surgery. Doing it a little younger can avoid some of that because it's not as an extreme. That's the other thing with doing it younger, is when you wait to be older and you do a facelift, everybody's going to notice because it's going to be more of an extreme change, unless you stage it and you do a little bit at a time and kind of gradually work yourself into it. The last thing I think that's changed is the fillers have advanced, which is good, because I think there are some patients, Priscilla Presley comes to mind, patients that, earlier on the injectables were silicone. And a lot of these patients had silicone injected in their faces, not knowing that they could never get it out again, that once it's in there, it's permanent and it's very difficult to remove. And so they're stuck with these permanent fillers in their face, and they have to kind of adjust throughout their life, trying to figure out how to move it around or put it in the right place. Nowadays, the answer, in my mind, is either the artificial fillers or fat grafting, because it is some of what you're naturally losing in your face. Very natural and will age with you. It's also has stem cells in it. It's going to help rejuvenate the skin and the surrounding structures. These techniques have advanced to the point where you combine a little bit of skin tightening, a little bit of muscle tightening, and a little bit of filling with your own fat, and together you get a very natural, pretty result. One of the main concerns about patients with facelifts are if they've seen patients with older techniques and they're like, oh my God, I could see their scars, I could see things are moved, things are different, their tragus is missing, or they have a pixie ear pulled down here, and all of those things in modern day techniques should not happen. The two different types of facelifts I get a lot of questions about are, what is a mini lift, what is a full facelift, what's the difference? And really it's the incision length and how high up you're going in the hairline and how much you're pulling. Also, the second part of that can be, is it a deep plane facelift or just a skin-only facelift? And what I think people should know is that there are a lot of marketing campaigns and a lot of people out there selling the newest, greatest, best type of facelift, and it's this new feather lift, ponytails, and different lifts that are out there. They're all essentially very similar types of facelifts with slight modifications. So don't necessarily think this one's so much better than this one or that one's so much better than that one. It really comes down to being an experienced, certified surgeon doing the technique more than the specific sort of technique you're looking for. Most contemporary facelifts, if you're looking for one that's going to look natural and is going to last, you want to be looking into something that's called a deep plane lift, or that's going to adjust the deep layers of the face as well as the skin. As long as you go into an experienced doctor, they're going to know where the nerves are and structures in the face are and everything, and it's extremely safe. And you'll end up looking younger and rested and prettier and not strange or pulled or things are in the wrong position. Facelift encompasses everything from your neck to your mid-face. So from here to here. Now from here to here used to be called a mid-facelift. Some people are still doing those procedures, and it's some of what gives you a cat eye. Other people are doing fat grafting into the mid-face to rejuvenate that loss of volume or a combination thereof. And then lastly is from here up is called a brow lift. And when you're doing a facelift, you want to look at all these things, because if you only tighten one part of the face, and you may have seen some of these actresses that the neck will look really tight, but the brow will be out of balance, or something else will look not in tandem or the same age as other parts of the face, things will start to look off again. So when you're going in to look at the face, you want to look at all of that, from neck all the way up to the brow. When we're looking at good facelifts, that's what we're going to notice, that patients are in balance, everything it's undetectable, everything looks natural. And one that I think is a nice facelift is Sonia Morgan. I think that surgery is done well. She looks like herself, but younger, prettier, rested, doesn't have any strangeness to her face. Another person that has done her rejuvenation over the years correctly is Jane Fonda. Throughout the years, you've noticed her aging naturally, but also gracefully. And I think that has a lot to do with minor tweaks along the way, good facelifts that, again, don't give away the secret. She looks rested, she's being filled but not overfilled, she's being tightened but not over tightened. And I think she's also balanced that out well. In other words, you'll notice that the brow, the face, the neck, everything's in balance, and one of them is not out of balance with the other features. Two other people that come to mind are Dolly Parton and Cher. I think both of them have been in the limelight for decades. Both of them have been known to do multiple surgeries. They're not shy about it. I think one of the interesting things about Dolly is that she's kept her look throughout the years. In other words, she's still recognizable as Dolly Parton. She doesn't look like a totally different person. Although her nose and other things have changed throughout the years, the typical aging, the tips dropped, it's got changed shape, it's typical changes you see with aging and not necessarily a rhinoplasty. been very vocal about it, so I think that, again, she doesn't look too overfilled or too overplumped. Same thing with Cher. Throughout the years, multiple tweaks, multiple changes. She's been somewhat vocal, maybe not totally transparent, but somewhat vocal about her surgery. Although we've seen changes in her nose and other changes in her facial structure, she's still Cher. Again, that's the right way to do this. Looking younger, looking great for your age, but not like completely strange or somebody totally different. One thing I wanted to broach on was pricing. In this world, I think, as well as the extremes, both ways, right? You don't want to seek extremes in plastic surgery. You also don't need extremes in pricing, right? So if you don't want to go bargain shopping for this facelift because, again, very complicated structures in the face. If there are complications, whether it's nerve damage, other things in the face, overdone, they're very difficult to fix and can be very expensive to fix. So instead of bargain shopping, I'd steer away from that and go at least to somebody that's experienced and maybe a little bit more money, but in the end, you're going to end up being much happier with the results. On the other side of things, I also think there's extreme pricing, overpricing, so don't get taken advantage of as well. In other words, once you're in the range of a normal price of a facelift, there are some super extremes, hundreds of thousands. That's just not necessary. So keep yourself in that middle range. Don't underpay and don't overpay. How will you know? Go to a couple different consults, get a range, call the offices, what is your pricing? Try to narrow that down into what seems like a reasonable price for your surgery.